Hello everyone, I'm Dr. Sienna Miller. I'm a naturopathic physician specializing in dermatology. I own my own telemedicine functional dermatology practice where I am dedicated to identifying and treating the root cause of common skin conditions. If you're interested in working with me, my information will be linked down below. But let's get into the video. So today I'm going to be talking all about leaky gut. What does it mean? What causes it? What are some symptoms? How can we test for it? And then what are different management and prevention strategies if you feel like you might have it or if it's confirmed that you might have it. So leaky gut basically means increased intestinal permeability. Your digestive tract, primarily the small intestine, needs to be permeable to some extent because that's how we absorb vitamins and nutrients from our food, supplements, medications, etc., etc. Things need to be able to pass through the intestinal lining to get into the bloodstream. But what can happen for various different reasons is that mucosal barrier function and all the different layers to that can get kind of broken down. The junctions between your epithelial cells can get pulled apart, and then larger particles than usual are allowed to pass through, and they can contribute to various symptoms, inflammation, other conditions in the body. And especially, this is especially important to think about when we're thinking about dermatology and the gut-skin connection, which is so strong. What are some causes of leaky gut? So common causes of leaky gut would be low microbial diversity, so low level of your good bacteria in your gut. And this can be caused by, low intake of microbes. So maybe you're not getting enough probiotic rich foods, especially if you've had antibiotics or food poisoning. It can be caused by overgrowth of pathogens or not opportunistic microbes. So this could be bacteria, yeast, parasites, viruses, things like that. Food sensitivities or food allergies or just different dietary components that can contribute to inflammation in the body that might trigger your immune system more than others, which would be the case for like sensitivities, allergies, celiac disease, lactose intolerance, non-celiac gluten sensitivity, things like that can contribute to some inflammation. Various medications, especially like NSAIDs or other painkillers, can degrade that mucosal lining. Alcohol can contribute as well. And the last thing I want to mention is a low fiber diet that can contribute as well. So what are some symptoms you might have leaky gut? Definitely if you have digestive symptoms, that can be a sign. It puts you at increased risk of some of these other things we talked about, like overgrowth, low microbial diversity, things like that, other GI conditions, SIBO, candida overgrowth in the gut, and those all put you at risk of potential leaky gut. But one of the biggest key pictures that makes me think that it might be going on is when people say they get non-GI related symptoms, especially after eating. So when I hear someone say, when I eat sugar, when I eat gluten, when I eat something with a lot of yeast in it, I'll get brain fog, I'll get headaches, I'll get body aches, joint pain, I'll get really tired. That tells me that something's getting through that gut lining that's not supposed to, and it's causing these non-GI related symptoms. So that is probably the biggest key that that flags me as that might be going on. How can we confirm or test for leaky gut? So this isn't something that can be seen visually on something such as like an endoscopy or colonoscopy, something like that. This really needs to be identified based on stool test results. There are specific markers that are associated with leaky gut. So a fecal zonulin is an example of that. That can be added on to like a GI map or the Genova GIFX stool test. I'm sure there's some other ones, but that's an add-on marker. I don't often order that marker because there's some signs on a normal stool test that leaky gut may be going on. And a couple of those are, like I said, low levels of good bacteria, particularly a couple species called Akkermansia and Faecalibacterium. Those specific species help to promote integrity of the mucosal barrier function. Akkermansia specifically stimulates mucin production, which the mucin is a big thick layer of mucus basically that protects the epithelial lining. So if those levels are low, that's kind of flagging me. If there's a lot of overgrowth, whether it be bacteria, parasites, and fungus or yeast, there's a lot of overgrowth going on that also flags me as there might be some leaky gut going on. And then lastly is secretory IgA, which can be seen on functional stool tests such as the GI map or the Genova GIFX. Secretory IgA is a reflection of your gut mucosal immune system. The biggest key factors when this is really low, it just basically means your gut mucosal immune system is no longer mounting an effective response. When I see this being very high, that tells me there's inflammation going on and there could be leaky gut, or at least you're probably headed towards that if your immune system is just overactive and going crazy. So once we've identified that it might be going on, what are some ways we can treat it? Well, obviously it's really nice to have the stool test because then we can identify exactly what's going on for you specifically. So if there is overgrowth, we treat that. If there's not enough good bacteria, we treat that. If there's lots of inflammation, we do obviously treat those things, but also we'll do like mucosal healing formula. So there's various different ingredients that help to tighten up the tight junctions in your epithelial lining. They help to kind of replenish the mucus. They help to soothe inflammation and just kind of repair that gut barrier function. And then lastly is just avoiding triggers. So if you seem to have certain foods that are inflammatory to you based on different testing, sometimes avoiding those foods, although I don't really like to focus on elimination unless it's something that's really important, such as celiac disease. Following a high fiber diet, especially high in vegetables and a wide variety of different types of fiber. And then avoiding certain medications as best you can. Obviously follow the instruction of your doctor, and if you need something like an antibiotic, painkiller, etc., like take that if you need to. But if we can't avoid those, it's ideal if we're talking about your gut health in general. And then lastly, avoiding alcohol is helpful as well. All right, I think that's everything I wanted to mention today. That's just my quick overview of what leaky gut is, different ways we can test for it, and then how I manage it personally. Like I said, it's the GI map that I run. Everybody is extremely helpful at identifying if this is going on and then what might be contributing to that. GI map's also important to help identify like why you're having digestive symptoms and then skin symptoms as well. I run that on all my skin patients, and that's kind of my mainstay of treating skin disease, is addressing gut health, among other things, of course. Hope you enjoyed this video. Follow if you want to see more video, or subscribe to my channel if you want to see more related videos. Give this video a thumbs up if you enjoyed it. Leave a comment down below if you have questions. If you're interested in working with me, you can find my website down below. I do all telemedicine visits, so I'm able to see people from lots of different locations. I do free 15-minute phone consults for everyone, and I actually recommend that before you schedule a visit. So if you're interested in working with me, you can find that information down below. But I will see you in my next video. Thank you for watching.